Welcome to the FL Community Podcast, created for the community by the community, where we discuss living with follicular lymphoma with a particular focus on thriving beyond diagnosis both physically and mentally. The following podcast is for informational purposes only and is not a substitute for medical advice. Please speak with your doctor before making any health decisions. Hello and welcome back to episode 2 of the FL Community Podcast. My name is Nikki Greenhalgh. I'm here with Dr. Paul and Nicola, and I just want to say a huge thank you for the incredible response for our first episode. We've had lots of emails come in to the FL Community Podcast at gmail.com. So I want to thank everyone in the community for sending all of those in. It's given us lots of wonderful ideas for future episodes. But now today we're diving into something that comes up for nearly, a lot of people with follicular lymphoma at some point, and something that I'm just recently entered into myself, and that is watch and wait. So it is one of the most misunderstood parts of the journey, I think, with follicular lymphoma. You're told that you have cancer, but then you're told we're not treating it yet. So it can feel confusing and frustrating and even quite isolating. If you don't really understand what it means or why it's recommended. That's what we're here for today, and we can talk about it. So let's go, guys.
Yeah, watch and wait, a really big topic. I think we see a lot of posts about it on the Facebook group. It's a really often quite confusing concept when we think about cancer. Is that your experience, Nikki, in terms of the Facebook group I'm thinking of?
Yeah, absolutely. It's a scary sort of thought to not do something about it in the beginning, because I know when I remember feeling so grateful because I'd heard that people go and watch and wait, and I remember feeling so grateful that, oh, thank God I'm not on watch and wait. But now I know what I know. I realize now it's actually a really good treatment strategy that has a lot of evidence behind it.
Right.
That shows that it actually doesn't, immediate treatment isn't going to actually improve survival when you're in the early stage, and you might be asymptomatic, which means you're not having any symptoms. So it might be the better way to go. You're avoiding those toxic treatments, which is really a great thing.
Yeah.
And might improve your health outcomes. So, and it gives you that time to research what treatments you might need to have in the future.
Yeah, it's just so counterintuitive though, isn't it? Because you're being told, I think we heard this in the last episode, right? In terms of your response, Nicola, like what you wanted to do, wanted to get it out of you, straight away, get rid of this cancer, which is a very understandable response. But, with watch and wait, you're effectively being told, just sit back and wait for it to get worse, which feels so counterintuitive. But as you were saying, it's evidence-based. What do they call it? Active surveillance. You're being given time, which is one of the benefits and I guess curses, if you like, of follicular lymphoma, because you're not having to, in many cases, actively treat it straight away. But then at the same time, you're left with the uncertainty, which for me is an important word with follicular lymphoma. And watch and wait kind of typifies that. I think you have to, you get the gift of time, but you also get the curse of not being in control of your health. But ultimately you come to really, I guess, trust in the doctors and the science and just enjoy this period without intervention if you are lucky enough to have it, which not everybody does. I guess we should talk about our own experiences. I know we're all kind of different experts in different ways, if you like, of watch and wait. You, Nicola, have similar to me for 7 years I was on watch and wait before treatment. You're still on it, which I'm really pleased about for you.
Me too.
Yeah, indeed. And I know you, Nikki, have just gone on watch and wait after relapsing, which we heard about last episode. I guess it'd be good to hear a bit more detail about your individual experiences. What was yours like, Nicola, of watch and wait, and what's it been like all these years?
Yeah, I think watch and wait is a very strange thing to be in. It's like you say, you want it treated, and it's only been recently that I've really been grateful to be on watch and wait. When you get treatment, you feel like something's been done. With watch and wait, it's just like a limbo feeling. At some point you are just watching and waiting for something to happen.
Right. It feels so passive, doesn't it?
Yeah, it's kind of like you want to do something, but And I remember when I was told I was going to go and watch and wait, and I said to my consultant, is there anything I can do to help with this?
Mm.
And I remember him saying, there's nothing you can do, just go home, live your life, and basically come and see me every 3 months. We'll do tests, I'll check you over, and then hopefully it'll be 3 months after that. And I did get into a sort of live in a 3 monthly block of
Right.
life. I
Yeah.
would, the week or two before my tests, I would get really anxious, and then running up to my hospital appointment, the anxiety would kick in. And the first couple of times I remember going in and saying, yeah, your bloods are all okay, everything looks okay, see me in 3 months. And I would leave the hospital like, yes, and me and my husband would be all happy. And then as it went on, it kind of become a bit like, oh yeah, I've been told everything's okay, but I've still got this incurable cancer. And it was a real sort of head mangle of not knowing what to think. But yeah, I've really got into researching about just well-being, nutrition, exercise, mental health. I'm not ashamed to say I speak to a therapist once a month still, which massively helps. In England, we've got a charity called Macmillan who have been amazing. And I have been lucky enough to have a great hospital team. I've had the same hematologist, oncologist from the start. I've had the same nurses. So we've really built up like a trust between us. I'm just grateful now to be on watch and wait and not having sort of worry of having treatment. But it does feel really strange at the same time, because sometimes I look at the group and patient stories and I read them and I just think, how are they coping? They're going through these treatments, and I can't relate to that because I haven't been through it. So sometimes I do feel a bit like an imposter. Like I've got cancer, but I'm not a normal cancer patient in getting therapy, like treatment and therapies. And yeah, so it sometimes it does feel heavy, and sometimes I don't think about it, and then I'll look in the mirror and I think, oh, I've got cancer, and it will just be like, it's strange.
And it brings you back.
It brings me right back down.
You mentioned the tests that you have, and I know some people listening won't, watch and wait will be new to them. Maybe they've just gone on it, maybe they've not even heard of that yet, or it's not been an option for them. What kind of tests are generally done when you're on watch and wait?
So in England, it's just blood tests. I just get I've gone from 3 monthly to 4 monthly now. We're just trying to sort of drag it out a bit longer, so it's 4 monthly. Yeah, it's just a series of blood tests.
And what do they tell us? What are they looking for when they're giving this blood test?
Basically, they're just looking just at my organs to see if it's impacting. And I suppose it's the first line to let my consultant know if my liver functions off, or if my blood count's off. They can start to think, what's going on here? We need to look. And my consultant, I'm so lucky to have a great consultant. He's very conservative in not over scanning. So my last CT scan was 2019. So it's quite a way ago. Most of the time I'm grateful that I'm not getting a lot of scans. But there are some times when I think, what's going on inside that we can't see? Are they growing? But yeah, I think in different countries, they do scan a lot more. I've seen from the group that people have regular annual scans. So yeah, I think it differs from country to country. And I think, I'm not sure if that's a good thing or a bad thing to have scans a lot of the time.
I think it's generally better to have less if possible, but it's such a balance, isn't it? Because you want to know what's going on in your body, but you want to avoid too much radiation. I know I've had the most I've had in the last year, just because I've been in treatment and checking if it's working, and after I finished, I don't know what you feel, Nikki, about scans, but my general belief is as much as you can avoid them, but obviously they're going to be
Mm.
inevitable at some time.
Yeah.
And the blood tests I think are interesting because my understanding is that often our blood tests can be completely fine, but then that's only one aspect, and there can be stuff going on that requires treatment that the blood test doesn't pick up. So it can give us sometimes a bit of a false sense of security, but generally
Yeah.
speaking, it's very reassuring to get those
Mm.
perfect blood test responses back.
In the first episode, I mentioned that in my initial diagnosis, I went to my doctor and he did a blood test and I didn't hear from him. So my bloods were completely normal.
Mm,
So it did make me sort of wonder, Nicola, when you were talking about it, what sort of things are they looking for in your blood test? I mean, as a nutritionist, I would be thinking, okay, well, obviously they're looking at your white blood cells,
Yeah.
like your lymphocytes, and I'll also be looking for the inflammatory markers like the
Yeah.
CRP, C-reactive protein, or ESR.
hmm
And like you said, your liver function, like your liver enzymes, they'll be looking at that. And I do understand they look for LDH as well. When
Yeah.
that tends to go up,
hmm
it's a bit of a red flag as well.
mm,
So yeah, so I think they're the things that I think that they would be looking for. But me being on Watch and Wait now, my doctor has said to me, come back in 6 months. But if I
Yeah.
experience any B symptoms, like fever or more weight loss, because I've already experienced a bit of weight loss in the last
mm,
12 months. Then give them a call. But yeah, no blood tests. But also coming back to the scans, when my treatment that I had initially was called HotMap-Thera. It was a clinical trial and it involved me having immunotherapy. So I had rituximab and I was also injected with radioactive iodine, and I was put under house arrest for a few weeks. So I was radioactive.
Mm.
mm,
So, yeah, so my hematologist at the time said to me, we don't want you having any more scans if you can help it. So,
Because of the radiation.
mm.
Yeah.
yeah. And it was 11 years between scans for me. So,
Wow.
yeah. So I hadn't had one since 2014. So,
Mm,
yeah, I'm grateful not that the doctors said that because I was already exposed to quite a lot of radiation. They were trying to keep that on the down low. And for
mm,
me, because mine presented with lumps, I don't know about you guys, whether I know you mentioned, Paul, that you could visibly feel a lump in your
mm.
groin area.
Mm.
Nicola, can you feel any
I've
lumps?
never felt my lumps are in I've got two, one's bigger than the other, and I've never been able to feel them.
Mm.
So yeah,
Wow.
I've
Yeah.
I mean,
There weren't any in any other areas of your body? Was
no,
it
it's
just
just,
localized?
yeah,
That's interesting. So what stage did they put you at when you were first diagnosed?
it was stage two. I
Yeah.
am. So
Yeah.
I think what you said was they'd caught it very, very early. Um, and I think had I not have had um, my diverticulitis problems, I probably would still be unaware that I had it.
Mm, mm,
Because I mean, I do, the only thing I do notice is if like I have a busy weekend or if I do something or if I go out for the day, I know the next day I need to like not do much, just sit,
right.
read a book because I'm like flagging. Um,
Right. So it's taxing your system maybe in some way, kind of minimally at the moment, but you recognize.
Yeah, I get
Mm,
fatigued a lot
right.
if I do a lot. But it's
Mm,
not like general day-to-day things I'm okay with. But it's just if I do something like big or if I go out or if I've been on holiday, I know the next couple of days I'm going to be a bit
Mm.
fatigued and just
right.
take it easy and then I'm fine again after that.
Yeah,
So yeah.
Yeah.
that's good.
I love that you're
But
listening to your body, doing that
yeah.
self-care that you really need because I mean, I know I can get into the trap of just being so busy and I run on autopilot and I just ignore,
Yeah.
the fatigue that's there. I know I
Mm,
used
Mm,
to do that a lot, but the self-care is so important and reading those signs
definitely.
that your body's telling you to
Yeah.
rest when you need to. Absolutely.
yeah.
So yeah, really
Yeah.
good.
I was going to ask you, Nikki, because you're newly on Watch and Wait, like how are you coping with it? Like how, this is very different, I'm sure, from your initial diagnosis and then rushing straight to treatment. What
Yeah.
have you changed much? Have you? I know you've always been good with your diet, or especially since you've been diagnosed, and exercise
Yeah.
and stuff. Like, what's different for you this time?
I have, my hematologist did say to me that he wanted me to exercise more. So that's
Mm,
one thing I
mm,
have changed is ramp up my exercise. So I'm doing some strength training at the moment and Pilates and yoga. I love my Pilates and my
mhm.
yoga.
Mm.
So I'm doing all of that, but I've added a strength conditioning sort of plan that I do three, sometimes four times a week if I can add another one in, just to prepare myself as well. If I need treatment, anytime soon. Because I did lose in the last 12 months, I've lost about 10 kilos. So
Right.
Mm.
I've had to be more mindful about putting on some weight.
Yeah.
And I do try to mindfully eat, but I did find in the first 6 months of the year, I'd lost my appetite. That obviously contributed to me losing weight. But now that I know that I've relapsed and I can, I'm putting more focus on my health and focusing on, particularly with nutrition, my focus is, and I encourage other watch and waiters to do this, focus on reducing inflammation in your body and
Yeah.
just boosting your immune system as much as you can. So
Right.
that's what I've been focusing on and the exercise, but also most importantly, I've been focusing on how I feel within myself, my mental health, which, as I
Mm.
mentioned in the first episode, it's been struggling. I've been struggling a lot in the last 6 months. So my focus is releasing, emotional energy that I don't need because I find that I hold on to things a lot. I'm quite an
Mm.
empath.
Hmm.
And I do find that when I'm seeing clients one on one, that I tend to hold on. I feel them so much, and I tend to hold on to that energy and don't let it go. So I'm doing a lot of meditation at the moment, a lot of yoga, um, a lot of breathing, just trying to learn how to release that emotional energy
Mm.
and
Hmm.
try and reduce my stress because I think it's so important. I feel
Yeah.
like it can lead to inflammation in the body. So that's my focus at the moment.
That's
Yeah.
great. That's great. I guess we all have different kinds of therapies. I mean, you mentioned, Nicola, that you see a therapist once a month, which is great.
Hmm.
I have my own therapy, a group therapy actually,
Oh,
which is fantastic.
Yeah.
I am a big proponent for group therapy. And yeah, it sounds like I don't know if you have therapy as well, Nikki, but
I am.
oh,
I see a
fantastic.
therapist. Yes,
Okay,
I've
great.
in the last 3 months when I knew I was
Mm.
once I knew I'd relapsed, I knew that I was going to need that extra support. So I've been seeing a therapist regularly since
Great.
then.
Okay.
Mm.
Yeah, and I
So
think
that plus
it's
your
yeah.
meditation and your exercise,
Oh.
you're really hitting it from all sides, it sounds like.
Yeah.
Mm.
Yes, so hopefully when I go back and see my hematologist in November, and hopefully my lumps have reduced. That's my plan.
Hmm.
So stay
Fingers
tuned.
crossed.
Yes, yes.
Yes, fingers crossed. I'm lucky because I can feel them. I mean, I don't know if you can. There's a big one on the side of my neck. I don't know if you can see that. Maybe a little bit.
Maybe slightly, yeah.
Yeah.
Yeah. Oh,
Yeah,
yeah,
so
yeah.
there's a big one I can feel there. I've got a
Mm.
couple in my groin area, my armpits, so I can feel them. I know they're there. It's
Hmm.
easy for me to gauge if I'm doing well. So I guess,
Yeah.
I'm lucky in that way.
Mm.
Yeah, so let's see how I go.
Yeah, indeed. I mean, just thinking about your nodes there, that's where mine started off, as I mentioned, kind of in my groin area, but they spread over a few years north, and then they started to appear quite not bulky in my neck, but they were quite palpable and obvious. Actually, my neck looked like I'd been working out on this side, like it was really obvious. But the
Mm.
Yeah.
biggest one, similar to you, Nicola, but bigger, was a 10 centimeter one in my
Oh, wow.
abdomen, which was kind of long and thin,
Ah,
but 10
Mm.
centimeters, which is, bulky
wow.
really.
Mm.
And that's kind of what made them want to kind of treat. So I came
Mm.
off watch and wait in October, November last year. That's when they started talking about treatment. I'm based in Spain, and I've got a doctor back in the UK as well that I can contact if I need to. And the doctor here, we'll talk about treatments another time in detail, but they really wanted me to do R-CHOP, which is one of the more the stronger, slightly more aggressive chemo regimens,
Yeah.
I guess, that are available to us. Where you definitely lose your hair. For most people, it takes a big toll on you. Whereas the UK doctor, it was borderline because there was this big tumor in my belly, but I
Mm.
wasn't having any real symptoms apart from I also lost 10 kilos. I'd realized over a year. They were recommending bendamustine and rituximab, which is, a chemo regimen with an immunotherapy, but it is generally seen as less strong compared to R-CHOP, although it gives
Toxic,
your
yeah.
immune system a bit of a hit. You know, it does wipe you out in that way. And so I started that treatment in December with a bit of back and forth and second opinions and collaboration with the doctor. And I'm, yeah, pleased to say I'm in remission since my fourth treatment, finished in May. I don't, am I in watch and wait now, or am I, it's a remission? I guess it's different. I don't quite know
Yeah. So
what to
your
call it.
Yeah.
last so have you had a PET scan since you finished treatment?
I had one at, yes, I had one at
Yeah.
4 treatments, one after 6, and then I'm going to have another one, which I don't really want, but it's necessary in September, just to confirm. And then I'm going to potentially start maintenance, which is again a topic for
Right.
another podcast, I think.
That is
Yeah.
that's a big topic. I know for
Yeah.
me when I had my last PET scan, they said I was in NED, so no evidence of
Yeah.
disease.
That's what I got told too.
Yeah.
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 So it's not watch and wait technically, but it kind of feels like it because I'm just waiting for it to come back fundamentally, you know?
Absolutely. In those first 2 years,
Mhm.
I felt like, because when I left the hospital, they said to me, expect it to come back in 3 to 5 years, but if it comes back in within 2 years, then your prognosis is worse. And
Right.
so that's,
Mm.
yeah, so those
Right.
first few years after finishing treatment I was very on edge
Yeah.
and, very scared. But once I got past those 2 years, then I sort of moved on to think, okay, so it's 3 to 5 years, it'll come back because you really hold on to those numbers that they
You
tell
do.
you.
Yeah.
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 They don't know you, you know you. So,
Exactly that. And I think that's why even though I was thinking I wasn't going to do the maintenance, I've had different opinions and it's not an exact science. I mean, and this stuff can't be. I think
Mm.
knowing that it might help me in those initial few years post-treatment if my immune system's coping with it well. And I'm bouncing back. My bloods are getting better and better since May, which is good. I'm thinking I'm going to do it. But I was just thinking about the Facebook group actually, and kind of, I don't know if this chimes with either of your experiences, but I know when I was in Watch and Wait, I felt quite avoidant of the group. You know, even though I was
Mm.
monitoring it and moderating, I couldn't invest too deeply in some of the posts because it was another world, as you were saying, Nicola. Like,
Yeah.
these people having these crazy, sometimes awful experiences,
Mm.
treatments, and there was me just, I'm fine. Like I'm just waiting. I'm watching and waiting.
Yeah.
Um, so I kind of didn't want to delve too deeply into it because again, for mental health. But then when I knew I needed treatment, it suddenly became a lifeline. And I was looking up everybody who'd mentioned the chemo I was doing, bendamustine and rituximab, and helping others who were just starting once I was a few in or once I'd finished. And it really kind of changed my relationship to the group. So I'd be curious about your experiences with regards to how you use the group. Nikki, it's been your group for many years, and we came on more, afterwards.
yeah.
But mm,
Yeah. Well, I hope now that I'm relapsing, I'm on watch wait because yeah, like you said, I haven't sort of been as active as a patient. I've been more active as as an admin or moderator
mm, mm,
and uh yeah, I haven't, it's been years since I really asked a real question.
mm,
I was sort of holding back because I didn't
Mm.
I wanted to sort of announced my relapse on the podcast. I didn't really want to and I was still, processing the information myself and,
mm,
trying to, but I think, as time goes on, as need to start making some serious decisions, I'll be sort of sharing more with the group, but I'm always searching the group.
yeah,
Before
Mm.
I would put up a
Yeah.
post, I'll search the group first just to see
mm,
what information is out there. And a lot of the times my questions answered from
yeah.
what's already out there.
It's
Yeah.
such a wealth of information, isn't it? Even on like something like maintenance, you search that and you get so many hundreds of posts and all these different opinions and experiences. It's such a wealth of information about
Oh, yeah.
everything.
And it never goes out of date, does it? It's,
Right,
No.
right.
yeah,
Yeah,
it's
yeah.
always relevant.
One
Yeah.
of
Yeah.
the things I was going to say about as a mental health practitioner was one of the most difficult parts of watch and wait, and we've touched on it before, is that idea of uncertainty and
Mm.
how do you move forward knowing that you've got this respite, this limbo period, You're not having to do anything immediately active. But that passivity for me, I'm quite an active type A type person, want to keep pushing, keep exercising, keep fulfilling ambitions, all of that. And it did, talking about last episode about how it helped us, it helped me to slow down in certain areas and know when I was pushing myself too much. But sometimes it has the opposite effect, and it makes me go, I'm going to work out twice today. Everything I eat is going to be organic. I can really get into a bit of an addictive cycle, healthy on one level, but maybe not so healthy on another.
Oh yeah, I've been there.
Right. So I was going to ask both of you, what does this watch and wait, the psychology of the uncertainty, do to both of you?
It's just having some of that control, isn't it? And it's interesting you say about addictive, Paul, because I think that's what I've sort of become focused on, which is my diet, eating organic. I haven't drank alcohol in 5 years, which kind of wasn't my choice. I've never been a big drinker, but I would have a glass of wine and I would be so drunk feeling, and I would have a hangover for 2-3 days with one glass of wine. And I was thinking, and I have researched it, and it is a common symptom of blood cancer patients. They have an intolerance to alcohol.
I'm the same, actually, so I didn't know that.
Yeah, it's really strange.
I thought it was because I'm getting older.
Oh, right. Well, we all experience the same thing. That's really fascinating. Okay.
No, it takes me days to get over, even just a couple of glasses of wine. But I still like a glass or two of wine with my girlfriends, maybe once a week but it does affect me. I used to be able to drink a lot more, and I wouldn't get the same hangovers. So it's interesting to know, Nicola. Maybe not my age.
So I've been teetotal for 5 years, and just really got addicted to what I ate. It had to be organic. I cut out like sugar, chocolate, cakes. I was so strict with myself, and that went on for a while, and I just thought, this isn't fun. You need cake in your life. You need to treat yourself.
Indeed.
Exactly. Yeah.
So I do eat organic now, and I think the most important thing for me is processed food. I probably 90% of my diet is non-processed. And I think that's a massive thing for like inflammation. Because when you get something and there's like 20 ingredients on the back of the packet and you don't know what half of them means. It's like
danger.
So I'm quite more relaxed now but when I think it was to get that control, like make me feel like I was doing something.
Maybe it's useful, like initially, as long as it doesn't become a way of existing, like if it boosts you into a certain, new way of relating to food and exercise, it can be helpful. But I guess this, Nikki, is a great intersection between our two professions, if you like, in terms of food, obviously nutrition and addiction, or disordered eating, which, I don't know if this would come under. It's not, at that level, but it is, I guess, control, and trying to control something that is really, I wouldn't say uncontrollable, because I think diet can play a huge part in, complementing any regimens we have with, medical interventions or before they're needed. But I'd be fascinated to hear your experiences and your expertise around this, Nikki.
Well, diet and lifestyle is the one thing we can control. We can't control when we'll be having treatment or what, a lot of the time, not the treatment that we will have. So focusing on diet, I think, is really important, but I also think it's really important not to restrict yourself too much, because you don't want to become malnourished. I think what's really important is to, if you can, work with a nutritionist or a dietitian to try and identify deficiencies that you might be having. Like, you could be lacking iron or vitamin D. That's a huge one. Anyone, particularly with cancer, should make sure they've got sufficient vitamin D. Working with someone to help identify what's missing and replacing that. And like you said, Nicola, focusing on, reducing inflammation in your body and limiting those ultra processed foods is one of those important factors in reducing inflammation. Another one to help reduce inflammation will be making sure you're having lots of colourful vegetables, fruit and vegetables, because they're just full of antioxidants, and that's their powerhouse for reducing inflammation. And on top of that, lots of good fats, omega-3s. If you can get your ratio of omega-3 higher than omega-6, you're on the path to reducing inflammation in your body. So those are really important things to focus on, as well as, like I said before, in boosting your immune system, because our cancer is cancer of the immune system. So we need to focus on that. It's important before treatment and after treatment, making sure that, we can monitor ourselves based on how many colds or flus that we get per year. I know for me, when I finish treatment, my immune system is still, even 11 years after I finish treatment, the numbers are saying that my immune system is compromised and struggling. But I actually do qualify for IgG infusions. But my doctor's agreed that I don't have to, because he's looking at me as a person and seeing that I'm actually doing pretty well at keeping my immune system strong, because I'm not getting sick all the time like I was after I finished treatment. So that's so important. And your diet plays a huge role in that, as well as exercise too. That plays a huge role. And also, like our gut microbiome, I want to do a whole episode on our gut microbiome.
Oh, yeah.
It's so interesting.
Oh, absolutely. And, even just going for a walk can help your gut microbiome. It's not all about food, and we have a microbiome. It's not just in our gut, but on our skin, in our mouth. There's microbiomes all over our bodies. So I'm looking forward to talking about that in future episodes.
Right. We'll break these down, I think, into episodes, right? So exercise, nutrition, mental health, sleep, I think, is another one of the pillars of, success for us, especially on Watch and Wait. I mean, you're preparing your body. Well, you're looking after your body, but you're also preparing it ultimately for treatment, which is hopefully a long way down the line. But as you and I, Nikki, know that it comes and you have to be ready for it. And I think, I got my blood tested. I checked how good my vitamin D levels were. I made sure I was having lots of omega-3. And I do credit it with, as well as looking after my mental health, my body being ready to take on ultimately these toxins, these poisons that I needed to have, which I was very clear about. But I think it set me up very well. So would you say there is a particular diet for Watch and Wait, or is it a general diet you would kind of recommend for everybody?
I think it really depends on the individual and where they're at. That's why I really recommend working with, like a clinical nutritionist or a dietitian one-on-one, because, everybody eats differently in different areas of the world as well. There's a lot of, Western diets in those more Western areas, and then, and then there's other diets in completely different countries. And don't forget, in the living with follicular lymphoma, there's members from over 100 different countries all over the world. So it really depends on the person. But sticking to those main things like reducing inflammation, boosting your immune system, improving your gut, I think is probably one of the most important things before treatment, is ensuring that your gut is in a good condition. And you can do that by doing functional testing. You can check, we're really only hitting the tip of the iceberg when it comes to research around our gut microbiome, particularly preparing it for treatment. But there is some clear research out there how beneficial it is, particularly for immunotherapy, which a lot of us tend to have, either on its own or in combination. So I think there's a lot to be said about your gut microbiome. So making sure you're having probiotic foods as well as prebiotic foods, which is our fiber. So making sure we're getting good amount of fiber in our diet every single day, and couple that with a lot of hydration as well.
Right. And I was downing kefir and eating sauerkraut and kimchi and everything just to try and prepare myself, which is lovely.
Well
And
done.
I can't have it now while I'm immunocompromised, but I can't wait to get back to, I'm almost there, so I can start eating kimchi again and sauerkraut and
Beautiful.
kefir.
Yeah.
And kind of on the back of that, Nikki, I would say that in terms of mental health, just to reiterate what we said earlier, if you can, I know it's difficult, not everyone can afford a therapist or it's not available, but if you can, and a group is much more cost effective actually than an individual. And there are often many organizations, cancer organizations like Macmillan that you mentioned, Nicola, that provide therapy or access to therapies, particularly during watch and wait, but obviously the whole journey. But it's kind of vital because we're dealing with something very unique, very specific. It's not a go in and get it out type of cancer for many of us. It's you live with this, and the mental health aspect is often for many of us the most difficult part until we need treatment. And ideally, you need someone to support you with that. Again, ideally beyond just friends and family who are invaluable but can't do all of the work. So just as you say, get a nutritionist, which I 100% agree with if you can, a therapist or a mental health practitioner would be really helpful too.
Absolutely. And I just want to point out in the community, we do have a mentorship feature where you can be connected with another community member as a mentor. So people have signed up for this. So it's a feature in the group that, use it if you want to connect with someone, or just put a post up and say, I really want to connect with someone, even in my area, face to face, you'll find that likely there is someone that's in your area that's in the community living with FL. That connection with people, I think is so important for our mental health.
Yeah, definitely.
Absolutely.
Reminds me of my friend Linda, who I met when I was living in California in a tiny little town, and we met and we're both in the Facebook group. That's how we found each other. We would meet for coffee, and Linda's just gone through a treatment herself. So it's been really nice to have that support at the same time. I would echo that. It's really important.
Yeah. Oh, yeah. I'm just so lucky for the friendships that I made from the community. Even where I live. I live Western Australia, and I'm right near Perth, so we've got a nice big group of us that we all meet up. We have lunch, at least every couple of months. We even go away for weekends every now and then. So,
oh wow.
and that's great because we just talk about everything and anything, and no one really understands as much as we do. So it's such a comforting thing to have when you've got that support.
Yeah,
definitely it is.
I think we've about kind of finished the second episode, right?
Fantastic.
That's watch and wait, big subject. We'll return to it in different guises and through different guests and things in the future, but it's a bit of an intro to the subject. As always, we want to encourage you to send us your emails on, for suggestions for future topics, feedback on what we're doing and whether you like it. Any kind of constructive criticism would be appreciated. And what's our topic for the third episode, Nicola?
So that is treatment side effects. So both yourself and Nikki can...
I've got a lot to say.
A lot, yeah.
Oh, yeah. Bring on the nutrition. Looking forward to this.
Yeah, great. And that'll be our third episode. And that brings us to the end of our second episode. Thank you both. It's fun. We're getting our bearings, I think, knowing how to kind of do this, getting a bit easier.
Yes, and I'm very appreciative of all the emails coming through to the FL Community Podcast at gmail.com. And I would like to encourage our community members to send us some emails. We have an anniversary coming up, our 10-year anniversary this November from when I set up the group. So we want to celebrate that. So if you could email us your ideas of maybe what we could do to celebrate, we would love that. So, and maybe we could read them out in the next episode. And
sounds great.
Do a poll maybe.
We will see you all next time.
All right. Should we finish off with our motto? Yeah. All right. And remember, here at the FL Community Podcast, our motto is...
From surviving to thriving.
One story at a time. Thank you, everybody. See you next time.
Thank you.